Welcome to CityWise. I'm your host, Tiana Stevens. CityWise is produced by the City of Rochester to shine a spotlight on city living at its best. Well, their mission is to improve the health of the community by working together to promote, protect, and support breastfeeding as the norm. The Rochester Regional Breastfeeding Coalition is a strong advocate and an important resource for families, healthcare providers, and local employers. Rosemary Bonacorso is a breastfeeding coordinator and nutritionist for the Monroe County WIC program, and Holly Wadanka is a senior health project coordinator at the University of Rochester Medical Center and the Department of Public Health Sciences. Both are members of the coalition, and we're happy to have you on today.
Thank you.
Thank you.
What is the mission of the Rochester Regional Breastfeeding Coalition?
The mission is to improve the health of the greater Rochester region by promoting breastfeeding as the optimal feeding choice for infants through education, advocacy, collaboration, and increasing access to support.
Mm-hmm. And Rosemary, how did the coalition form?
The coalition was formed through a group of people who were already networking and collaborating in different areas of breastfeeding support and policy. And we all came together instead of working in our separate silos to kind of collaboratively work on this project of improving breastfeeding in the Rochester area.
Sure. Holly, why is breastfeeding so important?
Breastfeeding is nature's food for infants. It's what breasts were made for. The benefits to mother and baby are extensive. As far as improvements in health for infants, it's been linked to decreased rates of SIDS, fewer respiratory infections, long-term cognitive development improvements, higher IQ, decreased cancer risks for some cancers.
Oh, wow.
Reduced ear infections, and then also for mothers, it's been linked to reduced rates of diabetes for mothers, less postnatal depression, and again, some reproductive cancer reductions if they breastfed their children.
Okay. Rosemary, what are the numbers currently? How many women locally are breastfeeding?
Well, in New York State, it's about 82%.
Okay.
In the Rochester area, it's a little bit less. And the numbers that I'm most familiar with, I work in public health. The WIC numbers for our area are less. There's a disparity, about 72% initiation. And when you look at duration across the board, statewide and locally, it drops off. So this is kind of where the coalition is looking to help improve our duration rates.
Okay.
And there are a couple different areas we're working on to do that.
If I can just build on one thing.
Sure.
Yeah.
When we mention the rates of 80 to 82%, that may sound, wow, that's pretty good. But we're talking about initiation, which means all the woman has to do is put the baby to the breast one time, and it's considered initiating. But we see those rates drop significantly almost immediately after they're discharged after the birth hospitalization.
Okay. So Rosemary, what are some of the things that you do in the WIC office to help encourage women or to breastfeed and keep breastfeeding?
Right. We do education, prenatally, support, postpartum. We have breastfeeding peer counselor services. All of the staff is trained. It's a priority for WIC to be a breastfeeding leader.
And Holly, from the U of R and the work that you do, are you more research focused?
Yes, we've been working on a research project for about 9 years now with the overall goals of improving breastfeeding outcomes,
Okay.
promotion and support among primarily low-income women in Monroe County.
Okay. What are the general areas of focus for the coalition right now?
We're working on policy. We're working on education for the public and for professionals. And we're working towards work site breastfeeding friendly work environments.
Okay.
Also collaboration between, the professionals who take care of moms prenatally and postpartum.
Okay.
And also support.
Oh, sure. Who are some of the other coalition members, or what type of fields do they represent?
We've got lactation consultants from different healthcare facilities, hospitals. Some are in private practice. We've got nursing staff who work with women. We have the lay professionals who are out in the community. We have doctors.
Researchers, just in general,
Yeah.
community members who maybe were breastfeeders themselves and are vested in the cause and want to help normalize breastfeeding to make it easier for other women.
Sure. So is the work of the coalition, is this part of a larger movement happening statewide, or is this something just for Rochester?
It's statewide.
Okay.
And it's national as well. We have the New York State Breastfeeding Coalition, which we're linked to,
Okay.
and then the U.S. Breastfeeding Committee.
Okay.
So
You mentioned that you work with local employers with education initiatives, and you have a special program that you put in place last year. Can you tell us about that?
well, the Breastfeeding Welcome Here decal program was for businesses who want to be noted as breastfeeding friendly.
Okay.
And that was to let the public know they support breastfeeding, customers who may be breastfeeding moms, but it also helps educate the staff within the organization or the employer's place of work that these are the rights for breastfeeding moms, and this is what we're protecting when our customers come in who are breastfeeding.
So what are some of the guidelines that you tell those businesses that they should be putting in place to make sure that it's a welcoming location?
Well, first of all, that any woman who's breastfeeding can do that wherever they want. There are New York State laws in place to protect this. Whether or not everyone's aware of that is another thing.
Okay.
But they give them tips for possibly customers who are not aware of these laws, like how to help them feel comfortable.
Okay.
So they'll give them options, like, for example, would you like to be seated somewhere else? If that sort of thing.
Okay. What other resources are available to moms and families in Rochester that the coalition makes people aware of?
We make them aware of resources to get support and education. Groups like La Leche League. We have a calendar of events where people can look up what's going on as far as continuing education for professionals. Any lactation-related events would be on our website.
Okay. Holly, what has the feedback been so far from the community or business owners about the work that the coalition's doing?
Among most, it's been very receptive. Again, one of our overall goals of the coalition, as well as the independent people that make up the coalition, is to make breastfeeding the norm again. And that's part of the education process. So, talking about the the Breastfeeding Welcome Here campaign, we did have to do a little education with some of the facilities that we made contact with regarding why this is important. Many of them weren't aware of the law, not that they weren't receptive,
Okay.
but they weren't aware of the law that a woman has the right to breastfeed any place she has the right to be. And many women aren't aware of the law. So once that little bit of education was done, most places were very receptive to what we were trying to do. Part of the education process, as Rose mentioned, is also for the customer who is possibly witnessing someone breastfeeding in public. You may have to educate them as well that she has the right to do that. If they want to be seated someplace else because they're uncomfortable, that's an option as well.
Okay.
You know, breastfeeding was the norm for hundreds and hundreds and hundreds of years. It's sad that we have to now take a step back and try to re-educate the community to make breastfeeding, to make it friendlier for breastfeeding moms.
For more information about the Rochester Regional Breastfeeding Coalition, you can contact Rose Bonacorso at 585-753-5086, or you can visit RochesterRegionalBreastfeedingCoalition.com.